Good evening, I'm Cathy Cole, the Cancer Program Director at Robles Hospital. We have a very special treat for you this evening. I'm going to introduce to you a Nurse Navigator at Los Robles who specializes in breast cancer care, Yvonne Ruiz. Yvonne, hi, thanks for being here.
Hi, Cathy. Thank you for having me.
Of course. Why don't you tell us first and foremost, what is a navigator?
I actually get asked this question quite often. So a navigator is a patient's personal guide and advocate after they receive a cancer diagnosis and throughout their cancer treatment. And it's a very stressful and overwhelming time for patients and their families. And we try to ease their burden by decreasing their anxiety and providing individual and ongoing support for them.
That's a big role.
Yes, it is. Yes, it is.
What kind of training is involved in doing nurse navigation?
So an oncology nurse navigator is a registered nurse with typically many years of experience in oncology. They're normally certified in oncology, and we have specialized training in navigation. And we reinforce education to the patients and their families about what to expect and how to deal with the bumps in the road. We also reinforce education about their diagnosis and treatment, and how to deal with side effects and symptom management, as well as how to identify problems before they happen. And a big part of our job is trying to make sure patients are getting to where they need to go in a timely manner.
Wow, so that sounds like you are a really integral part of the cancer care team, and you partner with the doctors that the patient has to see. So what kind of opportunities can you provide for the patient that fills those gaps where the doctors are focusing on the clinical diagnosis? You're helping in what other pathways?
So we talk about, we collaborate and with the cancer, collaborate and coordinate with the healthcare team, and we basically act as a liaison between the patients and the healthcare team. Mm-hmm. So we advocate for the patients. We remove barriers to care. And a barrier to care is anything that might get in the way of a patient receiving their treatment. This can be something like a communication barrier, maybe they don't speak the language, or a psychosocial barrier, or a financial barrier, it's a very big one. Or it can even be something like transportation. Maybe they don't have a ride to get there. Mm-hmm. And so a navigator assesses these needs, and we assess their distress levels, and we link them to resources in the community or the hospital resources, or even national resources. And navigators are very, very good at finding these resources.
So can you give us an example of a situation where you worked with a patient in one of these barriers and had a positive outcome?
Absolutely. So one patient that comes to mind is a patient who had a very aggressive type of breast cancer. She was underinsured and she really needed to have chemotherapy. It was imperative. And her copayment was $6,000, and she just didn't have the money. And she was kind of stuck in this limbo of a maze, not really sure where to go.
And needing to start treatment.
And needing to start it right away. And so actually a physician asked if I could get involved and see what I could do. And so I basically called and emailed the world, and someone got back to me that I thought might be able to help. So I called her and explained the situation to her, and she filled out a copayment application, a financial assistance application at the drug manufacturer, and within 1 to 2 days, she received she was successful, and the copayment went down to $100, and the patient actually received her care within like a week or two after that.
Well, that's just an amazing success story.
Yes.
So, if you had to talk about what your day is like, mm-hmm. How does your day start? How do you know who you're going to help on any particular day?
That's actually a very good question. So I look at the surgery schedule, and I see who's having surgery, what type of surgery they're going to have, and then I individualize their packet, an information packet for them based on the kind of surgery they're having, and it might have information about what to expect after their surgery, post-op instructions, and cancer support community information, and I put all of these things into a packet. And I basically set my schedule, and I go to see these patients in the pre-op area right before they have surgery. They're always very, very scared, and they're very, very happy and relieved to see me because I tell them, look, I'm gonna follow you along after your surgery. I'm gonna call you, I'm gonna check on you, and they really are relieved, and they feel a whole lot better that somebody's gonna be following up with them.
And you do offer this service, of course, to the family.
Of course.
Those are probably just as nervous a group of people besides the patient.
Everybody is nervous, yes.
Yeah. Mm-hmm. Okay. Well, it brings me to a question about the history of, it sounds like navigation is so important and should have been a part of cancer care for decades. Can you tell me some of the history of how navigation came about?
Yes, actually this is very interesting. So in 1989, they had the National Hearings on Cancer, and they found some disparities among populations of women. So the following year, a phenomenal surgeon by the name of Dr. Freeman developed this patient navigation program to try to prevent these disparities to care. And what they found after the pilot program started was that the 5-year breast cancer survival rate went from 39% pre-navigation to 70% after the navigation program started. So that's huge. And they found how much of an impact a navigator can have on a patient's outcome.
Okay. So, you know, I had the privilege of meeting Dr. Freeman, and he has a navigation institute still in New York.
Oh, wow.
And that model became the model from Harlem Hospital to comprehensive cancer centers around the country.
Wow.
So you're just a part of the whole beginning network that's continued from that model to today.
He sounds like an amazing man.
A pretty amazing man, a surgeon, and still practicing.
Wow.
Yeah. Okay, so let me ask, what other things does a patient need that you can provide? Do you give comfort items? Do you have, what goes in that packet besides paperwork?
Yes. We call this the Navigator TLC, and this is actually my very, very favorite part of being a nurse. This is the caring part. This is the hand holding, and those encouraging words, and maybe being a shoulder to cry on. The reassurance. This is all very important and very necessary for these patients. And so what goes into the packet is, we have a little tote bag with little personal items for in the post-op period that might help them be more comfortable. Little pillows. We have these little pillows. We have a drain bag holder. We have post-op bras to help them.
So all the necessary things when they go home,
right?
They have something that they can use.
Right.
Okay. Do you have any other data to support this? Timeliness to care? You mentioned this in Harold Freeman's Harlem experience, but how's the timeliness to care in a suburban comprehensive cancer center?
So yes, it's very important, and I think this is one of the ways that having a nurse navigator has helped with improve these outcomes by improving this timeliness to care. They getting access to healthcare services and information. And so I think before navigation, patients were kind of getting a little bit lost in the system, and they weren't getting follow-up care. They weren't getting to their appointments that they needed to get to on time, and so navigation really filled that gap.
Well, this is really important because the American College of Surgeons is actually doing a national study on timeliness to care and the patient's perception of that. So you're an important part of that whole piece on the research. It's great.
Yeah.
So if there was one thing, I guess I would want to ask you, one thing that you've learned and experienced from being a navigator, what would you say?
Oh, I would say that we talk a lot about how navigators are important in educating and teaching the patients. And I would have to say that the patients really teach me, and they teach me a lot about life and what's important in life. And it's just really an honor and a privilege to be able to do my job every day.
Wow. How many patients do you actually, would you say, you interact with in a month or a year? I mean, it must be a lot of patients.
A lot.
Would there be anybody who wouldn't want your services?
I can't imagine.
No, I can't either.
Over 50, I would say, at least 60 patients in a month.
So that's a big responsibility.
Yes.
And I know you do it well. So Yvonne, in building relationships with patients, what are the kind of things that you do to establish your responsibilities with the patient, outline what you do? How do you keep them from falling off the edge?
So, of course, I keep in very close contact with them. I'm calling them very frequently throughout their treatment. And one of the things I love to do is I celebrate the milestones with them, the big milestones and the small milestones. And so, for example, if somebody is going through chemotherapy, I will often send them a personalized handwritten card, just hang in there, or, when they're finished, hey, good job, you're done. You made it through, you're awesome. Or sometimes a lot of times, every time actually at the end when I send their survivorship care plans, I will send them a card just thanking them for allowing me to care for them throughout the journey.
And that's so important. I mean, to come full circle with them.
Yes. Yeah, and speaking of that, I actually had the privilege of a patient asked me to walk with her at the Hope Walk, which we had recently, and that was really pretty special. She had finished her treatment, she was moving on, and I walked with her, so that was really special.
And tell me, I happen to know this story, but tell me about the patient who doesn't have any family and relied on you.
Oh, so a lot of times patients don't have support and they don't have family around or friends. And so this particular patient was a little older, and I was very concerned about her because she had to have chemotherapy. So she knew my face and she had known me from going along with her and guiding her through. And so she asked me to go to her first infusion with her of chemotherapy, and I did. And she found that familiar face, and I held her hand and explained what was going on and what was going to happen, and I think it made her feel much better.
Oh, I'm sure. So this is an important role that all comprehensive cancer programs should include a navigator, because it seems to me you're just the glue that keeps the whole journey together.
That's what they say.
And I want to thank you very much for taking the time with us today.
Thank you, Cathy.
Pleasure.